Can sleeping naked help fight diabetes? It might sound like an odd question at first, but there's more to it than meets the eye. The way we sleep, including what we wear, or don't wear, can have a significant impact on our overall health. It might seem like a strange question. However, when we dig deeper, we find that sleep quality and metabolic health are closely intertwined. But there's a surprising connection between our sleep and our metabolic health. Good sleep is essential for maintaining a healthy metabolism, which in turn helps regulate blood sugar levels. It all comes down to how well our bodies regulate temperature and how this affects our sleep quality. When we sleep in a cooler environment, our bodies can rest more efficiently, which can improve our overall health. Scientists are always learning more about these connections. Research has shown that poor sleep can lead to insulin resistance, a precursor to diabetes. They are finding new ways that sleep impacts our risk of developing conditions like diabetes. For instance, studies suggest that people who don't get enough sleep are at a higher risk of developing type 2 diabetes. While more research is needed on sleeping naked specifically, understanding the link between sleep and metabolism is crucial for everyone. The idea is that sleeping without clothes might help regulate body temperature better, leading to improved sleep quality. This essay will explore the fascinating link between sleep and diabetes. We'll look at how different sleep habits can affect your health, and what you can do to improve your sleep hygiene. We'll delve into the science behind it and explore practical tips to improve your sleep. From adjusting your bedroom environment to adopting better sleep practices, there are many ways to enhance your sleep quality. Ultimately, the goal is to empower you with knowledge to make informed decisions about your health. By understanding the connection between sleep and diabetes, you can take proactive steps to improve your well-being and reduce your risk of developing diabetes. Our bodies are designed to follow a natural temperature rhythm. This rhythm is linked to our sleep-wake cycle. As bedtime approaches, our body temperature naturally decreases. This drop in temperature signals to our brain that it's time to sleep. When we sleep, our body temperature continues to fluctuate. It reaches its lowest point in the early hours of the morning. This temperature dip is essential for deep, restorative sleep. If our body temperature is too high or too low, it can disrupt our sleep. This is where sleeping naked might come in. By removing excess layers of clothing, we allow our bodies to regulate temperature more effectively. Sleep is crucial for our overall health, including our metabolic health. It plays a vital role in how our bodies process and store energy from the food we eat. When we sleep, our bodies undergo various restorative processes that are essential for maintaining optimal health. This includes the regulation of hormones that control hunger and stress, which are directly linked to our metabolic functions. Chronic sleep deprivation, meaning not getting enough sleep consistently, is linked to an increased risk of developing type 2 diabetes. Studies have shown that people who regularly get less than 6 hours of sleep per night are more likely to develop this condition. Lack of sleep affects the body's ability to use insulin effectively, which is a key factor in diabetes. When we don't get enough sleep, our bodies have trouble regulating blood sugar levels. This dysregulation can cause blood sugar levels to remain elevated, which over time can lead to serious health issues. Poor sleep can also increase cravings for sugary and high-carbohydrate foods, further complicating blood sugar management. This can lead to insulin resistance, a condition where our cells don't respond to insulin as they should. Insulin resistance is a major risk factor for developing type 2 diabetes. It means that even though the body is producing insulin, the cells are not able to use it effectively, leading to higher blood sugar levels. Insulin is a hormone that helps our bodies use glucose for energy. It acts like a key, allowing glucose to enter cells where it can be used for energy. Without proper insulin function, glucose remains in the bloodstream, leading to elevated blood sugar levels. Over time, insulin resistance can lead to prediabetes, and eventually type 2 diabetes. Prediabetes is a condition where blood sugar levels are higher than normal, but not yet high enough to be classified as diabetes. If left unchecked, it can progress to full-blown diabetes, which requires more intensive management and can lead to other health complications. Getting enough quality sleep is essential for maintaining healthy blood sugar control and reducing the risk of developing these conditions. Prioritizing sleep can improve overall health, enhance mood, and boost energy levels, making it easier to manage daily activities and maintain a healthy lifestyle. Deep within our brain lies a small but mighty region called the hypothalamus. This tiny area plays a crucial role in regulating many essential bodily functions, including sleep, appetite, and body weight. The hypothalamus acts like our body's internal thermostat. It receives information from our internal systems and the external environment to adjust our temperature, hunger levels, and sleep-wake cycle. When it comes to metabolism, the hypothalamus helps control our energy balance. It does this by influencing our metabolism, which is the process by which our bodies convert food into energy. In recent years, scientists have made a groundbreaking discovery in understanding the hypothalamus. They have created HypoMap, a detailed map of the human hypothalamus. This map provides unprecedented insights into the complex workings of this vital brain region. HypoMap is already helping scientists identify new genes linked to obesity and diabetes. This discovery has the potential to revolutionize the way we treat these conditions. By understanding the specific genes and pathways involved in metabolic disorders, researchers can develop more targeted and effective treatments. HypoMap is a shining example of how scientific advancements are paving the way for better health outcomes. Section 6. Sleeping naked. Could it be beneficial for diabetes? Now that we've explored the link between sleep, temperature regulation, and diabetes, let's revisit the idea of sleeping naked. This might seem like an unconventional approach, but it has some interesting potential benefits that are worth considering. While more research is needed to confirm a direct link between sleeping naked and improved diabetes outcomes, we can draw some logical connections. For instance, studies have shown that maintaining an optimal body temperature during sleep can significantly impact sleep quality, which in turn affects overall health. Sleeping naked can promote better sleep by helping regulate body temperature. When your body is cooler, it can enter deeper stages of sleep more efficiently. This deeper sleep is crucial for various bodily functions, including hormone regulation and metabolic processes. A cooler body temperature can also activate brown fat, a type of fat that burns calories and helps regulate blood sugar. Brown fat activation is particularly interesting because it not only helps in burning calories, but also plays a role in improving insulin sensitivity, which is crucial for managing diabetes. Additionally, better sleep can reduce stress and cortisol levels, which are linked to insulin resistance and weight gain. High cortisol levels can lead to increased blood sugar levels, making it harder to manage diabetes. By improving sleep quality, you can potentially lower cortisol levels and improve your body's ability to regulate blood sugar. While sleeping naked alone won't cure diabetes, it could potentially contribute to better sleep quality and in turn, improved metabolic health. It's one of those small lifestyle changes that, when combined with other healthy habits, can make a significant difference over time. It's essential to approach this with a balanced perspective and consider it as part of a holistic approach to managing diabetes. This means incorporating other important factors such as a balanced diet, regular exercise, and proper medication management. Always consult with your healthcare provider before making any significant changes to your routine. Section 7. Food for sleep: what to eat and avoid. Believe it or not, what you eat can significantly impact your sleep quality. Certain foods contain nutrients that promote sleep, while others can disrupt it. Foods that can help you sleep better include turkey, kiwis, tart cherry juice, fatty fish, and fiber-rich foods. These foods contain tryptophan, melatonin, and other sleep-promoting compounds. On the other hand, avoid caffeine, alcohol, and sugary foods and drinks before bed. These substances can interfere with your sleep cycle and prevent you from getting restful sleep. Section 8. Creating a sleep sanctuary. Besides what you eat, your sleep environment can also significantly impact your sleep quality. Creating a sleep-conducive environment can make a world of difference in how well you sleep. Keep your bedroom cool, dark, and quiet. Aim for a temperature around 65 degrees Fahrenheit or 18 degrees Celsius. Use blackout curtains or an eye mask to block out light, and earplugs to minimize noise. Stick to a regular sleep schedule, even on weekends. This helps regulate your body's natural sleep-wake cycle. Dim the lights in the evening to signal to your brain that it's time to wind down. Section 9. A holistic approach to diabetes management. Managing diabetes effectively requires a multifaceted approach that addresses various aspects of your health. While sleep is crucial, it's not the only piece of the puzzle. In addition to prioritizing sleep, focus on maintaining a healthy diet, engaging in regular physical activity, managing stress levels, and taking prescribed medications as directed by your healthcare provider. Remember, there's no one-size-fits-all solution to managing diabetes. It's essential to work closely with your healthcare team to develop a personalized plan that meets your individual needs and goals.